you one of the things that separates their approach from many of the other companies is that it actually listens to what our pain point is and try to modify the product according to our problems, and also leads to meaningful engagement of the patients, leading to better outcomes. So without further ado, I'll let Dr.
Thank you,
Shane
and
talk
thank you
about
all for
this.
taking time out of your day to come here, little old me talk. First of all, I'm an internist, practicing doctor, have been for almost 20 years now. And I live in San Francisco, in the heart of Silicon Valley now. And you know, I started my practice in 1997, and the year that I finished my residency, I was told that the large HMO in San Francisco was being investigated by the Federal Trade Commission for having too many covered lives, and I couldn't be a doctor in the town that my father was the chief of surgery in. The town that my grandmother lived in, my sisters lived in. I had to go to Fresno or Bakersfield or somewhere else. And so I took a job working for this super old dude, and he said, I got one of these HMO things, and work with me for 1 year. I'm not going to pay you very much. You're going to work really hard. But at the end of 1 year, I will give you my practice. Now that practice was in the financial district of San Francisco. It was nowhere near the hospital system, like the hospital system here in San Francisco. They're all kind of clustered in an area. I was in the financial district in 1997. And by the way, the internet was turned on, I think in 1994, someone turned the switch on it. So all sorts of things were buzzing around in San Francisco, and companies that, you know, Go and Zoom, and I don't know if you remember them, but they were all like hatching in and around where I was. So I was taking care of some of these young internet people that were like raising all sorts of money, and I was just getting started, right? I was a year one, you know, pretty inexperienced doctor in year one. And at the end of the year, I thought, wow, I'm going to get this entire practice. I'm going to, you know, the old guy was just getting older and a little slower, and he was a little funky with the patients, and I just thought, you know, it's time to out with the old, in with the new. And at the end of the year, he says to me, you know, I'm really enjoying this. You're really giving me a lot of time to take off. Can we do this for 3 or 4 more years? And I said, no, we have an agreement here, and you know, I've been working hard and making like nothing. Like all my colleagues had graduated and were making real physician salaries, and I was making about a third, or less than half of whatever my colleagues made, and I was willing to take that risk because I wanted this practice. So he said, no, I'm not going to honor the agreement. So I called up my father, and I said, Dad, you're not going to believe this. This guy totally screwed me. And he said, no way. He said, well, what did you do? And I said, well, I quit. And my dad was kind of apoplectic. He said, what? You know, he just thought his son, the doctor, was going to take over, you know, his practice someday, even though he was a surgeon, which wasn't going to happen. I mean, although I'm pretty good with the scalpel. So I was walking down the street that day, trying to figure out what I was going to do with my life, because I really didn't have anything out in front of me. And I walked by, on the way home, and I walked by this building that I always walked by, and it had 5 stars emblazoned on the side of it. And on this particular day, I was paying attention to things, because normally I just walked home and whatever. And I looked up, and I was like, it was the Mandarin Oriental Hotel. I don't know if any of you know what that is, but it's a 5-star hotel. And there's like 3 5-star hotels in San Francisco, and I never even paid attention to it, because why would I? I could never afford a 5-star hotel. So I walked into the hotel, and I was just curious, and I was like, wow, marble floors, lots of staff, and everybody's fancy. And I walked up to the concierge desk, and said, and by the way, this was like 20 years ago, so it looked like I was 14. And I said, excuse me, who's the doctor for this hotel? And she looked at me and she said, and who are you? And I said, well, I think I could be the next doctor for this hotel. And she said, you're a doctor? I said, I am. And she said, well, with all due respect, Dr. Singh, I told her my name. She said, doctor, this is a 5-star hotel, and everything we do here is 5 stars. We refer our guests to 5-star restaurants. We use 5-star limos. You know, we're a 5-star outfit. She goes, and medicine, thank you, sir. Got lipstick on there? Awesome. Medicine, with all due respect, is a 5-star smart industry, but you guys are one-star service. You guys really don't focus on service because healthcare was built for doctors, not for patients. I mean, the system is engineered around how a physician needs to work in the world. And so I looked at her and I said, hey, look, teach me what 5-star service looks like. Just, you show me what 5-star service looks like. She goes, let me tell you what 5-star service looks like. She goes, when I paid you, you call me right back. If I call you on your cell phone, if you're not like in the middle of swimming, you answer it. And if I need a house call to someone to come to this hotel, you're here within less than an hour. I want to hear nothing but good news, and I don't want to hear that you charge too much. And I want you to follow up on a regular basis with those people. That's 5-star service. And I said, great. And so she said, look, I'll give you a shot, and if you screw up, you're out. Because we already have a doctor that you're going to displace, because they do have, you know. And she says, we take care of presidents of countries, we take care of movie stars, we take care of baseball players and basketball players. I mean, these are the people that come and stay at our hotel. So you've got to come suit and tie, as professional as they come, and people got to feel like they're being taken care of by a doctor. And I said, I got it, bring it. I got nothing else to do, I didn't tell her that. And I lived just, 10 minutes away. And so anyway, so I kind of cut my teeth right out of school learning about what 5-star service looks like according to the hospitality industry. And when you're in a hospital, there's not a lot of hospitality in our environment. It's never something that's taught to us. But what I learned to do is I learned to listen really good to the patients and what they wanted. And I learned to listen really well to the concierge staff and how they worked and how they wanted me to exist within their clientele. So I wound up building a pretty big business making house calls to all these hotels in San Francisco, because once I got the Mandarin, I walked over to the Ritz-Carlton and I said, who's the doctor for this hotel? Like, who are you? I said, I'm the doctor for the Mandarin. And they're like, oh. Then they would call the Mandarin, is this guy legit? He's legit. And the next thing you know, I had 7 doctors working for me. We were running around house calls all around San Francisco, and it was like this thriving enterprise. And in 5 years, I was taking care of all these people at hotels, and I realized that this is interesting, but I should probably be taking care of some people who live in San Francisco. And that, is that the without lipstick class? Thank you. I like the attention to detail there, Mike. Someone was listening to me. So anyway, so a couple years later, and then I'll get to the reason why we're here talking, is a little old lady came to my office, not that little, not that old, I guess, but 70. And she came in with a cough, fever, shortness of breath, and she had clearly a community-acquired pneumonia. So I listened to her lungs and I said, you know what, this is clearly pneumonia. And most of the people do just fine with good antibiotics, but a few percentage of people kind of like, bad outcomes can happen. And so here's my cell phone number, 7 digits, and here's the prescription, pharmacy across the street. If you're not better in 5 or 6 days, if you're not better in a couple days, call me, right? Because, maybe we need to add another antibiotic, maybe the antibiotic's ineffective, maybe I'm wrong in the diagnosis. I mean, there's lots of things that could happen if you're not doing better. So 7 days later, the phone rang, and it wasn't her, it was the emergency room saying she is now in respiratory distress, and she's on her way to the ICU to be put on a vent. We're not sure she's gonna make it. So if you're me, what are you thinking at that point? Why didn't she call me? I gave her my cell phone number and I made the friction 0 to get me, right? And then I thought, why didn't I call her? Shame on me. Maybe I should have checked in with her, right? I mean, and so today in medicine, for those of you who are medically oriented, can I just get a hand? Who's medically oriented here? Just so I can get a sense. So maybe a third. In medicine, we categorize people by a thing called a CPT code. And the CPT code is how complex they are and how much time we spent with them, kind of mashed into one code. And that's the code that we use to, when you come into my office for whatever, and there's all this gaming with upcoding and downcoding. So at that moment I thought, you know what, screw the CPT codes. Maybe I should reframe how I think about every patient. I'm either really concerned that a bad thing can happen, kind of concerned that a bad thing can happen, or I'm not that concerned that a bad thing can happen. Forget about how complex or how much time. Let me just categorize into I'm not that concerned, I'm kind of concerned, really concerned, that something bad could happen. So from that day forward, I opened up an Excel spreadsheet And every patient that came in my office, I categorized them as either 1, 2, or 3. And if they were, I was really concerned. Now this 70-year-old who was otherwise healthy just had pneumonia. I mean, ostensibly, I would be kind of concerned about her because when bad things can happen quickly, and that can be death actually. And you know, versus somebody with, you know, I don't know, a sore throat, I'd be kind of concerned, but it's not going to end in death. Very rarely it will. And so what I did is I opened up a spreadsheet, and every day I called my patients that I was really concerned about and kind of concerned about, and I'd say, tell me how you're doing today. Are you the same, or are you better, or are you worse than yesterday? Because the realization I had was when you have pneumonia and you're sick, you're not thinking clearly. You can't process this, you know, your brain, your human operating system is at like 50%. You got a fever, you're nauseous. I'm telling you to like call me if you're not feeling better, and you're just so sick, you're not thinking clearly. And oftentimes in medicine, we think that people think the way we're thinking. Do this, do this, do this. And guess what? They're sick. So I would call everybody and say, are you the same, better, or worse? And I would give you if you said better, I would give you a +1. If you were worse, I'd give you a -1. And if you were the same, I'd give you a -0.5. Because if you have pneumonia and you say same, 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 I really need to see a better in there because the trend has to be better. You're going to get better. And if you say same, that's a negative trend. If the line, it's kind of a downward slope. Because what happens is if you say same, 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 same pneumonia, the next day it's like you're in the ditch and you're, you know, it goes like that. It's like a slow thing and then you fall off the cliff. So anyway, so I did this spreadsheet, and then if you said better, same, better, then I would say, okay, I'm less concerned, I'd move you into my next category, and I would call you every other day. And I would do the same thing. I had this little rudimentary algorithm. And one day, one of my patients came to my office, and I was explaining to him this thing that I was doing, and he had just sold his software company to AOL for $900 million. and so he's like the software guru dude, right? And he said, hey man, you should, cell phones and spreadsheets, really? You should turn that into software. And I said, how am I going to do that? I'm a doctor, Jim, I'm not a scientist. And he said, well, I'll give you one of my programmers. He just made a bunch of money from the exit, and he's got nothing to do, and go meet with him. So I took this guy out for steak, and I said, here's my idea. And he said, you know, that would be pretty easy to code. And I said, well, listen, I've got like a couple little kids, my wife's pregnant, my practice is growing, I don't really have a lot of time to sit around and build software. He said, well, listen, after you put your kids to bed every night, we'll do a Skype meeting every Thursday, Tuesday and Thursday. And we'll wireframe some stuff up, and you'll tell me what you want, and I'll just try to build it, and you tell me if I'm mapping to what it is that you think it is. So we wound up with this thing where if you came into my office, I would say to you, look, I want to follow up with you. Are you interested? You know, you just got diagnosed with pneumonia. I said, all you got to do is check your email. It's an email prescription. It's like an email pill. It's a prescription. It's not a, I'd like you to do this. It's, you must do this. If you're taking antibiotics, you're checking your email too, because this is prescriptive. It's not for fun. It's not a parlor game. And you get an email, and in the email it'd say, Dr. Schlang wants to check in with you. And then in the body of the email, there was 3 hyperlinks. One that said, I'm the same, one that said I'm better, and one that said I'm worse. And all the patient had to do was click on the link, and they're done. Because as soon as they hit that link, it pings my database and scores you, and you're just done. You can delete the email. You don't even have to hit reply. This was V1, right? And then on my side, I would have a dashboard, and I would get this daily summary of all my patients, and I had the algorithm and the trend line, and if somebody hit a trend that wasn't good, like, they'd rise to the top and say, you gotta pay attention to this one. And so that was kind of like, so I did that, and then one of my buddies who's a urologist who does a lot of vasectomies, he said, hey man, I want to use that for my vasectomy patients because, you know, I don't see my guys, and, you know, occasionally infections happen, and it's a bad place to get an infection. And so he started using it and started blogging about how this cool thing was going on, that he could check in with his patients, you know, remotely and know all this, get all this high resolution data between visits, which he never otherwise got. And we added a little thing for comments, so patients could put in comments. He said, you know what, I'm getting comments and information about male patients because men don't really like to talk about this type of stuff, especially when they have to call an office and talk to a woman and say, I'd like to talk to the doctor about my stuff. So he found that by enabling men to communicate with him directly, get the middleman out, to communicate their concerns about stuff, he got a trove of information that he would have never gotten before. He'd been a urologist and professor for 15 years. So I was asked by the Henry J. Kaiser Family Foundation, someone heard about what I was doing, they read about it, this was in 2009 or something. And they said, hey, we're writing a white paper on reinventing primary care, and we needed someone to do the technology bit. Where does technology fit into primary care? We see you've got this thing called HealthLoop, and by the way, the name HealthLoop I came up with, and I went online, and it was owned by some guy who was a valet for a hotel in Tennessee, and he owned HealthLoop.com. And I'm like, hey, I use my Yahoo email, not my Dr. Shalane email. I'm like, hey, I want to buy that email. He goes, how much? And I said, I don't know, $500. He goes, how about 900? I'm like, done. So, I actually was thinking today I want to email him and tell him to go look at the site, because we've come a long way. So anyway, so I went to Washington, D.C., and in front of all these policy people, kind of wonks, lots of policy wonks, I made this presentation, HealthLoop, we had a way to follow up, and I was just out there talking about it, like I was kind of excited about it. It was an honor to be part of this white paper for the Kaiser Foundation. And after that meeting, this guy walked up to me and said, hey, that's a really big idea. You need to turn that into a real business. And I said, really? How do you do that? He goes, I'm going to write you a check for a couple $100,000, and I'm going to help you. And I'm like, who are you? What? We shared a cab together. It was raining, and we were the last two guys to get in the cab, and it was like, I don't know, kind of random. And he was the guy that was the CEO of Overture, which got bought by Yahoo for $1 billion. And he's just this guy who's getting interested in healthcare in his second part of his life. And so anyway, so we raised a couple $100,000. I formed this company. And my founder, the co-founder, who I gave 50% of the company to, this developer at the time. By the way, never give 50% of the company away to anybody over a steak and a couple glasses of wine. It was a really bad idea. And so I told him, I said, hey man, this thing's going to kind of evolve here, and you're such a pain in my ass. Every time I wanted to build something for healthcare, he'd say, no, that's not the way users want to do it. I know better. I'm an engineer. And let me tell you what user interface and so him and I had all these like major clashes as I was trying to move this thing along, and I realized that he wanted to build what he wanted to build. I wanted to build what I wanted to build, which was for doctors. If doctors don't use this, it doesn't work. If patients don't use this, it doesn't work. If both people don't use this, it doesn't work. Both people have to use this. So most apps, you engage with the app. There's not someone else on the other side of that app. So I had built this two-sided app, where you come in on this side, it did stuff, and then came in on that side, and so it was like an interface between two sets of people, which most apps aren't. Right? You interface with the app, and there's not like some degree of responsibility on either side. So after fighting with him, and so then we had this $200,000. We hired another guy, and next thing you know, we were getting low on money. So I said, well, let's just do it friends and family, and so we raised another couple $100,000. And we were literally just kind of like, we had no clue where this was going, but I had the backing of some guy that really believed in this, and I didn't know how deep his pockets were, but I didn't really want to push it. And we wound up, kind of doing this convertible note story, which, if you don't know what that is, it's just you borrow money, it's like a loan, and someday it will turn into equity and if it doesn't, if it fizzles out and dies, then everybody walks away and people go, well, I tried, and I don't actually have to pay back a loan. So when you get a loan from a bank, you got to pay it back. When you get a convertible note, the deal is, I think I'm going to do a moonshot here, and if it works, that little loan you gave me turns into this pile of equity that's been preordained by terms. But if it fails, then you lost your money, and I look like a douchebag for losing your money. And so every entrepreneur really wants to win, and they want to succeed. And so with grit and just tenacity, we got actually the cancer center, which our first customer called, I can't remember their name, it was in Tennessee, it'll come to me in a minute, and they said, we'll give you $20,000 to do a pilot study on, I can't remember, it was Radonk, I think, it was something in Radonk. And so we flew out to Wyoming, and they were just installing a new system, and that woman got pregnant, and they fired that woman, and it was like such a disaster of just trying to get it done, that they eventually never even became a client, but they paid us the 20 grand, and it was like a 20 grand. And I was like, okay, we got interest. They thought it was interesting, and this was early days. And so as the story goes, we eventually raised more money, and people said, hey Jordan, you have to make a decision of whether you're going to be a doctor or the CEO of this company, because you can't do both. And that was my existential moment of, I don't think I'm cut out for the CEO thing. I'm really good at being a doctor because I've been doing it for so long. So we hired a firm, a recruiting firm, and we hired Todd Johnson, who's sitting right here, who's going to show you a little bit more about where we've come since those days. And so we hired Todd and raised, and we were on this, I said, Todd, we're hiring you, but we only have 6 months of money left. So your job is to help us get lots of money before you're out of a job. Because by then we had, I don't know, 10, how many people when you joined? 12 people? I mean, that's a lot of, that's expensive company right there. You have a burn rate that's not trivial. And so we brought him on board and realized that there's no way we were going to raise our big round in that 6 months. So we did another convertible note, or we extended our note to get another $250,000, or I can't remember the numbers. And then the woman who really wanted to invest in us, the venture capitalist that was really interested, got pregnant and said, "Look, I'm having a baby. I gotta step away." We were like, "Oh no!" She was the one, and she had the baby, and then we had like 3 months of money left, and we were like, "Well, we'll have to do an internal round of all the people that have already invested. We're going to raise $1 million, and we'll just keep this thing going." And she kind of popped back up and back to have the kid, and she said, "You know what? I'm all in. We'd like to give you $6 million," and then someone else said, "We want to give you $1 million," and so that closed in November of last year. So we became, in 2013, and now digital health is blah, 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 all the rage, but in 2013, this was the largest Series A of an early stage company without a ton of traction in the marketplace that had ever been done. So she placed a pretty big bet down on us. And then, Todd's been the CEO ever since, and I've been slowly, relegated to the guy that occasionally gets a talk here. But I'll say that in the process, so most founders that start companies never want to give up the CEO role. It's their idea, it's their baby, they want to hold on to it, and you hear all these stories of the founder who hired the CEO and they got in a big fight, and the founder got bounced because the CEO is running the company and has the control. And so, I mean, the good news is I have a tremendous amount of respect for Todd. I would rather be a doctor than a CEO. We have a great rapport. We talk once a week, and I think that if you are founding a company, most founders eventually do not become the CEOs unless you're Mark Zuckerberg. But that's the 1 in 10,000 story. The other 1 in 9,999 is once a company gets to a stage where you're just an entrepreneur, you have to hire a professional manager. You have to hire a professional CEO, and you got to hire a professional team. So Todd's been a CEO before. He worked in the healthcare space and healthcare IT, and he clearly, young upstart CEO, had a good win, wants to do the next thing, and I wanted to place a bet. When we interviewed, I had met him in Washington, D.C. I said, "So tell me about yourself." And he goes, "Look, I'm an East Coast guy. I'm not a West Coast guy." I said, "Okay." He said, "The West Coast guys, what they want to do is they want to just raise as much money as they can and get traction and then figure out how to make money." He goes, "I want to generate revenue early. I am all about generating revenue." I'm like, "Dude, you were hired." I like that strategy because, the truth is that when you start a company, you must raise money to sustain yourself. But what you're trying to do as quickly as possible is get customer money so the investment money goes away. Right? You only live with either investment money or customer money, and you can't get investment money forever. You have got to start getting customer money and make the investors go away, and then you pay them off, and then you carry on. And so, now there's some people that say just get lots of eyeballs and prove the traction, and you'll Twitter. And there's a lot of companies that have just tried to focus on generating traction in the market and then monetize it later. And our strategy is really to do both, generate revenue and generate traction in the marketplace. So that's kind of the story of how I got here. And then we met Simran at Rock Health, because now I'm kind of on this quasi little speaker circuit when I'm not seeing patients. And Simran is helping us kind of introduce the HealthLoop to MD Anderson. So I'll stop there. I'm going to let Todd give you the 7-minute version of what is HealthLoop and how it's evolved. Should I take questions first?
Yes.
Okay, let me take some questions.
I'm sorry, I thought the meeting starts at 6:30. I walked in late. I started off with you joined with a guy in a cab. So I missed the part that what was your idea that you pitched?
Maybe he can talk afterwards because
yeah. Well, you'll see. You'll see.
Yeah.
And in the back.
I
have a question. I work in home health, and with the changes that are going on and formation of ACOs, have you guys looked at improving the flow of information throughout that system of care?
Yeah, so I got a couple of some lines for you. One is your data has a waiting room. You think you have a waiting room when you go to see a doctor? Your data has a waiting room, and it's called an EMR, right? And an EMR is an electronic medical record.
Right.
And your data is like a brick. It sits there, and it's in a database. I call it a database because ultimately someone's got to go into the database and get your data and do something with it. Otherwise, it just waits there for someone to get in there. So my whole thing is data must flow faster. Data needs to be lubricated, and the way data gets lubricated is it gets wrapped in context, and then it becomes actionable. So what I want as a physician and what you want as a patient is, hey, I was just given this bit here, now I know what to do with it. Because I can, take my worldview and take that bit of information and I can act on it. So what we all really want is actionable information. We don't want data. Data is, with all the quantified self, blah, 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 everybody thinks that more data is better. Actually, more data is just more data. Better data is better data. So more isn't better, better is better. And I think that we conflate the two often, especially in the quantified health. Let's do more is better. It's not. So I'm a big fan of getting data to flow. And so we have within the HealthLoop, which is the feedback loop between the doctor and the patient between visits, you can drop in a home health nurse, you can drop in anybody into the loop and they can participate in that loop. So you can have concentric loops going simultaneously.
Which makes HealthLoop ideal for ACOs. It's kind of a perfect set of incentives around managing patients to better outcomes using scalable technology.
Okay. Is there any component that actually deals with electronic signatures of records?
It's all part of the master plan. So like DocuSign or consent forms, that can all be thrown into the loop.
Gotcha.
Yeah. Yes, sir.
Two questions. One of them is, in your industry, HIPAA is a big constraint of policy. How did you overcome that? And the second thing is, what do you do with a situation where the patient doesn't answer the follow-up the email?
I'm going to answer the second one and let him answer the first one.
Okay.
So the second one is, I'll show you guys later, but I can show you an email I got today, because while we've been here, I checked in with 20 patients. 20 patients got messages from me. And the ones that don't check in, they light up too. This person missed 2 check-ins. Yeah. So I have 2 choices there. I can say maybe they're so sick or something happened to them. My staff can call them. They can go analog on them, right? So they just go analog and pick up the phone. Go deep and go analog, right? So or the second thing that we have in place is if you're the patient, right, and you have a 25-year-old son or let's call it 25-year-old daughter, and she loves you, right, and she cares about you, you can include her into the loop. And if you miss 2 check-ins, she gets notified. Hey, your dad has missed 2 check-ins. Because I'd rather have the person that loves you checking in on you, because they're going to respond much faster than me. Because I'm a doctor, I'm like a gear that's spinning like this.
For the wife. You skipped the wife?
Yeah, you need the wife. You skipped the wife.
Daughters care more about fathers than
The wife must be dead.
that's just psychology 101.
Free dead sometimes.
Especially at that age. I'm being silly. So that's the answer to the second question. He'll answer the first one. But before he does, can I let him come here? Is there any other questions before I enjoy my wine without lipstick on the mouth? Yes.
Very quick question. You mentioned that you started this idea back when the internet was first booming in 94,
97. No, 97.
97. Why did it take this long for you to develop this?
Okay, so sorry. So in 1998 is when I got religion on the fact that customer service was absent in healthcare. That was my hotel story, right? That's when I realized, and it took me until 2005, when that woman had pneumonia that I missed, that all of a sudden, wait a minute, I need a follow-up system. And I had a spreadsheet, and so, I think good ideas marinate, and they kind of come to you out of nowhere. I don't think it was like I realized there's an internet, there's a problem, I got a solution. I wasn't sitting around thinking of a business to start. I literally looked at the world and tried to absorb it and try to understand it, and then try to find something that mattered to people. And so I started this in 2006, 2005-06, when I started my spreadsheet, I spent a year and a half building the first version, which was 2007, and by the time I bumped into that guy in DC, it was 2009. I mean, so it was just kind of the slow road, kind of accidental, like people say, so what do you do? I was like, well, I'm a doctor, and I accidentally started a software company, in a way. But I think that oftentimes, you know, if you have like a crisp business plan, you think you're right, I mean, don't marry your strategy. Sleep with your strategy. Right? Because you could be wrong. And you don't want to get, and you don't want to be, you know, again, you know, you want to make sure that you're flexible and that you can move laterally if you need to, because the people that are like so sure and so right that they're going to win, I mean, venture capitalists say, look, I bet on two people. I mean, I only bet on one kind of people. But there's two kinds of people. There are those that want to be right, and there are those that want to be successful. Right? They bet on people that want to be successful. The people that are pig-headed and just overly dogmatic about they're right, that's their idea, you don't really want to bet on those people. I mean, there's got to be a little give and flex in the way you think about what you're doing so that you can, you know, because the world isn't like that. I mean, you know, Mark Zuckerberg started off with something and it's something else. You know, he didn't think that, I mean, it's evolved, and things always evolve because that's what time does to things.
I was more asking about the time of the actual software development, from when you finally put all the ideas together and when development started till today.
So again, I was doing Skype meetings every other night in 2007. It took me till like mid-2008 to get something. You know, I had to work out the bugs, and I had like a team of just me. And then in 2009, you know, I finally got it working, and then I showed it to my neurologist buddy. And it's like, again, there was no real plan. it was an experiment.
I see.
It was an experiment that I thought was a good idea, and others did too. Now I'm going to turn it over to Todd, who will answer the second question you had during his presentation, because this thing has now radically evolved into something else. Much better. And I'm going to take it outside. I hope I'm not going to
So I think, what is it? Sleep with many strategies? And pick the most encouraging one. So there's a question about HIPAA. Yeah, I think, so in my first enterprise, so prior to joining HealthLoop, I founded and grew and was the CEO of an acute care EMR company. And one of our anchor customers was Johns Hopkins Medicine, which is, you know, they think they're number one in the world, and in a lot of respects they are. And I'll never forget, we were installing an alpha version of a product on one of the attendings' computers one day. And during the Windows installer thing was going, and all of a sudden her screen, blue screen of death, right? Wasn't our fault, really. And she got furious. And she said to me at that moment in time, and I'll never forget it, she said, healthcare software must be held to a higher standard, because the implications of failure could be that people die. So I don't look at HIPAA as a barrier. And HIPAA is just one regulatory set of rules that we have to address, right? We as an industry, and we as service providers, and we as software vendors. You know, the irony is, dealing with HIPAA is not so much a technical hurdle as it is a policy hurdle, and it's a lot of brain damage to get your policies and procedures in line. But I think it's good practice, and we need to have good practice here, because failure to adhere does put patients at risk, and it puts our businesses at risk. As of October last year, even though I'm not a healthcare provider, I'm a business associate, and if we lose data, I don't look good in orange jumpsuits, nor do I ever want to wear one. So we take that pretty seriously, and I think it's a necessary part of entering this market, and you just have to accept it. So, any other questions? So I'm just going to do the quick HealthLoop thing, but if you guys would prefer to talk about business formation, business development, and other things, happy to go there too. So I actually put a bit of a spin. So my plan did not include joining an early stage company as a CEO and moving to California. I had gotten a world-class education in my first startup, selling to large integrated delivery systems, big enterprise software sales, 18-month sales cycles, 24-month implementation cycles, dealing with top docs and administrators and all the brain damage that entails. And I had sold my business to a company called Nuance, found myself as a senior vice president for an $8.5 billion market cap company realizing that I couldn't survive in that environment. I hated it. It was so boring to me, and it was like swimming through tar every day. Couldn't get anything done. Too much politics, too much stupidity, and so my plan, what I had sold to my wife was, hey, we just had a good exit from company number one. Let's go on vacation for 6 months to a year with the little kids and go hang out in Vermont and get a cabin and chill and go skiing and sit outside. And then I met that guy, wherever he went, and I said, this is before I had even resigned from my post at Nuance, and I said, shit, this is such a good idea, and it's coming at just the right time. And if I pass this up, it's gonna haunt me for the rest of my days. So I convinced my wife that it was time, that we should just go all in. So I moved to California to take the job, and Jordan was lying a little bit when he said we had 6 months of funding. We were supposed to have a year, and within 2 weeks of me hitting the ground, we had investment that was promised evaporated, and I had about 4 weeks of capital, which was terrible. And so we went into high energy fundraising mode really fast. And what I learned over that period of time was that there's plenty of free capital for good ideas. That this is a tremendously big market. We can have a ton of fun. And I learned a lot from the customers and prospects that I worked with, that he was really focused on, how do I monitor my patients every day, right? I want to know how she's doing, how she's doing, how she's doing. But patients want a little bit more, right? Patients want guidance and education and encouragement and support, and they want empathy and compassion and all these things that, as care providers, as doctors, as nurses, as medical assistants, we would love to be able to provide empathy, compassion, think of it as a hug every time we see a patient, but we haven't got the time, the patience, the energy to do that. We have a gazillion things. So what if we could create an experience for these patients where when we touch them to find out how they're doing, we also give them guidance, encouragement, get them through what they're going through in a really high-touch, compassionate way. And so I think that's something that I feel really strongly about. And so maybe when Jordan talks about not being married to your strategy, I think put my own print on where do we need this to go, and it's about creating more value on both sides of this equation. So what is it if you can integrate this high-touch patient experience with remote monitoring? Well, it means that patients are given guidance at every turn to build confidence, right? Decrease their anxiety, that we're answering their questions before they even had it, right? That you're giving them the right information at the right time, so they're doing the right things to get to a good outcome. And so HealthLoop as a platform is designed around carrying you through 2 weeks, 2 months, 2 years, whatever it is, for you to get out of this new disease or this injury or whatever it is back to life, right? In an automated way that feels like it's your doctor touching you every day, saying, hey Todd, how you doing? Right? That we fundamentally believe that as patients, our doctors are the most important and influential people in our healthcare, so we've designed this experience to feel like my doctor. And what's amazing is patients actually think of this as my doctor. They talk to their phone or their web browser as if it's their doctor. They assign sort of this human value to this totally automated and electronic experience, which is really amazing, right? That we've now inserted something that, because they never had that access before, they completely appreciate it and they respect it. And so we're sending patients these daily check-ins and giving them this empathy. Hey, you're doing great. Right? Keep up the good work, and we care about you, and we're looking forward to seeing you in 3 weeks. But we know, based on all these experiences, when patients get concerned because they call us, they call their doctor, they call the nurse. I'm worried about this, I'm worried about that. So we can anticipate all those questions and answer them before they needed to ask. Hey, you were discharged 4 days ago. You know what? You're probably starting to feel your strength come back, and that's great. But remember, we really want you to take it easy today. Don't overdo it, because some patients overdo it and they end up back in the emergency room, whatever it is, right? We give tools like checklists for patients so that they can self-manage. What are all the things that I need to do over the next month? And right now we sort of discharge patients, and it's out of sight, out of mind. We sort of expect that they're going to get these things done, right? Well, it's not easy to navigate the healthcare system, let alone remember what it is that I need to do. But really the main event in HealthLoop is, where Jordan originally started was, how are you doing today? And what started as, are you new, are you better, are you worse? We've blown that out, right? And so it's, hey, sometimes patients experience blood clots post-operatively. It's rare, but, tell me, do you have any calf pain, swelling, cramping in your calf? Because that would give us an indication. Oh, you do? Well, let's talk about that. And so this interrogation that assesses the patient so that if they are one of the 4 out of 100, right, that the care team is alerted. And that's really where the value of HealthLoop is really exposed. So, it detects the needle in the haystack, right? That the patient who is now self-reporting and donating all this information, that the system says, you know what, nurses, here you go, we got one, it's a live one. And you had mentioned the accountable care organization, right? And any at-risk provider organization, or really any physician and their team, wants to know if a patient's turning south. They want to get out in front of it and address it as quickly as they can. And so what we've learned at HealthLoop is that patient engagement is really, really easy. Patients desperately want to engage. We're scared, we're worried, we're nervous, we have questions, we've never done this before, we want guidance, we want education. But doctors, nurses, can't take any more engagement, right? We're so thin in our daily activities, including our clinical activities, our administrative activities, we don't have time for anything else. And so it has to deliver value to those care teams that literally drops on the floor, right? You can feel it. And where that value is, patients are calling all the time. We're sending in messages all the time with questions and concerns. So if we can immediately shut down that spigot of inbound information and get out in front of it, our patients are much quieter. and we can focus on those that need it the most. And then if you think about the workflow around these follow-up issues today, there is no workflow. Right, patient calls, maybe there's phone tag going back and forth. How do you manage the issue between the team? So this is, I get an SMS message that Mrs. Smith is at risk, and I'm a medical assistant, I'm a first responder. I can maybe deal with that myself, right? But if I can't, I forward it to the nurse practitioner or I forward it to the doctor, but I know that somebody's going to take care of it. So all the workflow around how do you manage and resolve these issues incredibly efficiently, we think is a tremendous opportunity to really help care teams become a lot more efficient. And so here's what we've learned. Unsurprisingly, patients are thrilled. They've never had an experience like this. Last time you got sick, how frequently did your doctor check in with you, right? Not. And so patients absolutely love this. And so another thing that we do to promote value for physicians is we can take those really satisfied patients and turn it into actionable benefit, right? So if you know that your patient is thrilled, the system actually redirects them to share that experience online in a way that promotes the physician and the practice in a really high-touch way. So something that's amazing is now that patient satisfaction is actually a financial metric. With Affordable Care, the Affordable Care Act, but ACOs in general, that all of a sudden patient satisfaction impacts my income. So people care about it now more than they did in the past. And yet, the way we assess patient satisfaction in general in the industry is we send patients surveys 30 days after they're discharged, and they get it in the mail. And we generally get about 7% of those, return, which isn't surprising. Actually, a pretty good response rate for a direct mailer. But what happens is the grumpy patients are the ones that, if they don't have an outlet, they go to Yelp, right? Or they go to Health Grades and they say, gosh, I waited for 4 hours, or gosh, they didn't give me any time, and so you have this sort of asymmetrically skewed representation of service online that is now beginning to influence patients. So 34% of patients say that they use physician reputation sites to help evaluate whether or not I'm going to go to that doctor. So that's not in a majority yet, but boy, is that thing coming, right? Who uses the Yellow Pages anymore, right? We use Yelp. Right? And Yelp is not a fantastic representation of clinical practice. So what's been amazing about HealthLoop is because we have patients checking in routinely, they're used to checking in, they check in with you 30 times, then boom, we hit them with, hey, can you take a minute and give us some feedback on how we're doing? 81% of our patients are electing to complete that patient SAT survey. And So we take the 5 out of 5 stars and then redirect them to physician rating sites. And 26% of patients out of your panel are going and leaving a 5-star review, which is amazing, right? And so that might just be this little extra icing on the cake, but I tell you, it really matters because now physicians are getting some kind of incremental benefit from making sure that their patients are doing well. So, so here's what we've learned. And actually, I'll skip this slide because you guys probably aren't too interested here. But you know, it's about detecting who's at risk, cutting down phone calls, reducing patient sat. But what we know now is patients love this. Right? They actually perceive their care to be of higher quality. And we see actually older patients much more engaged than younger patients. 65 to 75-year-old women are the most likely to be 100% engaged, right? So we've sort of debunked the myth that older patients won't use technology. But what they love about it is this is all about building confidence, and it's about convenience. They don't want to have to come back in if they've got an issue. Yeah?
As you make that point, are they engaging with the technology directly, or are you finding that they're going through a family member?
So it's almost all patients doing it directly. Yeah.
Through a smartphone or through an internet
Smartphone,
combination?
web browser, doesn't matter. So the technology base is responsive web. So all you need to play are an email address or a mobile phone with an SMS number and a web browser. Mm-hmm. And you know, we even have 90-year-old patients using HealthLoop, right? And you know, they've got more to lose, so they're hanging out on their computers, you know, really reading what their doctors are sending them. Right, and so the flip side to that is that doctors love this too, right? So again, it's all about operational efficiency and reputation, and I think we're firing on both cylinders. So let me just stop there. That's probably